So this is a short recorded video that's broken up into two parts. So it's about activity management, which is also known as pacing. The first part, we're going to talk about recognising the boom bust cycle and also the traffic light system. And then the second part, we're going to look at strategies at how we can implement some pacing techniques. So pacing is a well-known strategy that can help with pain management. Firstly, when we are doing a group-based session, we ask everybody to call out or write down some examples of everyday activities or perhaps some tasks and activities that you are currently unable to do. So I'd like you to pause this video and just come up with a few ideas of your own of some of these activities. So quite often, people talk about this pain activity cycle. So there is often a clear link between certain activities and the pain that we experience. So the first pacing technique is about trying to recognise how certain activities may affect your pain. So for some of us, we may already know this, and others it's not as clear. So when we first meet people, there might be some really clear examples of certain activities. So for example, a task that involves standing for long periods may increase their pain. Or it may also be certain activities that perhaps sitting for long periods of time, like going to the cinema, going to watch a 3-hour film would be too much because that also increases our pain. It may also be that certain activities actually help our pain. So maybe for someone, standing up, moving about might ease their pain, and for someone else, maybe sitting down, resting might ease their pain. When there are clear links between pain and activities, it might be that you start to avoid doing these activities because it's going to produce, have more increased pain. Sometimes, people might know that this task is going to increase pain, but it's about getting the job done, whatever the consequences. So that often people talk about housework. So getting all of the house done on one day, then they know it's done and, ready for the week ahead. Often patterns of good days and bad days can develop. So you find that their activity and pain is quite up and down. It may be that one day the pain isn't as bad, so that is when you're most productive and you get lots of things done. But you may be thinking, tomorrow I'm going to pay for it. And the next day you find actually you have increased pain, and to do that, to cope with that, you might spend the day resting, and some people might spend the day in bed, and their activity drops. So like I said before, the activity and the pain is very up and down, and that's just the table there that's on the bottom of the slide is just showing it's quite up and down. And that can be similar to how we feel on those days. So on a good day where we're more productive and perhaps we're not in as much pain, we may feel better. And conversely, on a day where we can't do as much as the day before and our pain is worse, it can really have an impact on our mood and how we feel. So what is activity management? So firstly, it's about recognising these pain activity patterns. It may be challenging old habits. So acknowledging perhaps ways that we've always done things. Are they good for us or not so good for us? And if they're not so good for us, it's maybe thinking, well, how can I do things differently? It might be about highlighting the tasks that are more challenging and thinking about how they can be broken down into more manageable chunks. It's about trying to find the middle road to avoid over and under activity. So if we think back to the last slide, where it's up and down, it's trying to think, well, actually, if I did a bit less on a good day, and then a little bit more on a not so good day, could I even that out? So rather than it being so up and down, could it be a little bit more in the middle? Activity management helps keep you active. So rather than doing it all on one day and not much on the other, you're doing a little bit every day. So overall, over the week, you are generally more active and it's more consistently active. Activity management can help actually reduce pain. By understanding your pain and the activity relationship can help you plan and perhaps avoid, these flare-ups and these not so good day. And by doing that, it may help you reduce medication. So on the not so good days, you're not having to rely on sort of medication. Again, because we're avoiding those not so good days, it can help reduce the feeling of frustration and low mood, which is associated with that boom-bust pattern. And importantly, it helps you get back to doing what is important to you, because we all know that how chronic pain can really strip you of doing the things that you love doing. So going back to your session with identifying value-based goals, activity management helps create a plan of how you're going to get there. It helps prioritise what it is you want to be doing with your time and your resources. It gives you opportunity for making these positive steps and positive changes to getting the life that you want and doing those value-based activities and goals. And we know with chronic pain, you can often feel out of control and that it is pain that is leading to decisions and perhaps having to reduce your activity. So by understanding that the relationship between pain and activity better and being able to plan around that better, it can give you, it can give you that more, you can be more in control of your life and those choices that you make, rather than pain driving those decisions. So there is a misconception with pacing that we often talk about with people. So there is this association that pacing is about stopping or doing less and slowing down. However, the better that you get at pacing, the more things you can get done and the less time you need to recover. When done well, pacing can be and feel empowering, and as it gives you something, a tool that you can tackle the hard things and the challenges of the day and helps you get back to doing the things that are important to you. Yes, we encourage rest to help break up those challenging activities, but this doesn't necessarily mean doing nothing. It's about alternating between the different types of activities. And it may be that you just need a certain break from a certain activity, and actually doing another activity may be less aggravating and gives you a break from the challenging activity. So the first part of activity management is really understanding that pain and activity cycle. So firstly, I'd like you to reflect on your own pain activity cycle and have a think about what is causing your boom-bust pattern. Recognise which bits of the everyday life that needs pacing. So you don't necessarily need to pace everything. It's just highlighting the specific tasks that perhaps aggravate your pain and are challenging. Once you identify these particular tasks, you can work on fixing them and doing them in a slightly different way. So at Wessex Rehab, we use the traffic light system, as it's a really nice way of just really fine picking and thinking more about just those everyday activities that you do. So we give certain activities red, the colour red. So these are certain activities that you feel are currently too difficult. And if and when you do, they're definitely going to provoke a flare-up of pain. They might cause you to stop in your tracks, and they may lead to that not so good day where you're needing to rest lots. For activities like that, we label them red. Then with the amber colour, it may be that we go about these activities a bit more cautiously, so we're wary of them. It may be things that we are doing and can do, but if we do them for too long, it will increase our pain. So for instance, standing for 5 minutes or 10 minutes may be okay, but if we stand for 20 minutes, 30 minutes, then that's flaring up our pain. So it's really good to have an idea of actually how long it is when things may become too much. So for those activities, we label amber. And lastly, the green activities. These are the activities that are absolutely fine, that do not have any influence on your pain. They may actually ease your pain as well. So these are the ones that we say they're the go activities. So the free activities that are absolutely fine. So what I'd like you to do is look back at that list that you made from the first couple of slides. And I'd like you to go through the activities that you've listed and just make a note whether you think they are red tasks, amber tasks, or green tasks. Thank you.